Assalamu alaikum everyone, welcome to my YouTube channel MediBill Pro. I hope you guys will be fine and doing great and enjoying your good lives. So today we are going to continue our session of interview. Okay, so how you guys can qualify your medical billing related interviews. So we are going to continue our session and this lecture is going to be the lecture number 4. So in this lecture we will be considering the questions regarding claim submission. So what kind of a questions can be arised or what kind of a questions can be asked to you while your interview. So we will cover all the most top kind of a questions in this session. Okay, so this session will be having a MCQs type of a questions because we have already started the MCQ series. So in this series we will be covering 15 questions in today's lecture. Okay, so in today's lecture I will be also providing you guys the answers of these MCQ type of questions as well. Okay, so without wasting time, I guess we should start the lecture. Okay, so here you go. So the first question is going to be what is the primary purpose of claim submission in medical billing? Okay, so you guys know that when a patient comes to a provider and for any kind of a services to get any kind of a service from that kind of provider, then the provider is going to make different kind of a claims and then they are going to submit the claims to an insurance company. So what is the basic purpose of that claim to submit to any kind of a insurance company? So the first option is going to be to verify patient's eligibility. Second is to request payment from an insurance, to schedule patient appointments, to diagnose the patient. Okay, so what should be the answer of this one? So the answer of this question is going to be the option number B, that is going to be the to request payment from an insurance payer. Okay, you guys know that when we are going to submit a claim to an insurance company, okay, so what is the basic purpose of that kind of a thing? We are just going to get the reimbursements. Okay, so basically the provider is going to get the reimbursements for those kind of a services which were rendered by him to any kind of a patient. Okay, so that is the main purpose of submitting claim to an insurance company. Okay, so this was the question number 1. So let's see what is the question number 2. Okay, so the question number 2 is going to be what form is typically used for submitting claim in outpatient services? Okay, so you guys need to focus on this one. Okay, so what kind of a form can be used for outpatient services? Okay, so that could be a UB0 form, CMS 1500, ICD 10 CM, or HCPCS, Healthcare Common Procedure Coding System. So what should be the answer of this one? The answer of this one question is going to be the option number B, that is going to be the CMS 1500 form. So for outpatient services, the form which is being used to submit a claim to an insurance company, that is called CMS 1500 form. Okay. Question number 3 is going to be what is a clean claim? Okay, as the name depicts, as the name reveals, what should be the name of, like, you can say that what is a clean claim? Okay, so a claim without any kind of errors, without any kind of a things, without any kind of discrepancies, you can say that. So that claim can be called as clean claim. Okay, so let's see the options. Option number A is going to be a claim that includes supporting documents, a claim with no errors or missing information, a claim submitted after denial, a claim that includes the patient's medical records. So what should be the answer? So I guess the answer is going to be the option number B. That is a claim with no errors or missing information. So a claim having all kind of a necessary information, including documentations, including the provider information, including the correct charges, including the patient information and the insurance information as well. So all that kind of a stuff should be corrected as well. Okay, so patient's eligibility should be already verified. Okay, so all a claim having all that kind of a necessity products, necessary information in that kind of claim and have no errors or discrepancies, then that kind of a claim can be called as a clean claim. Okay, so that is the answer of our third question. So let's see the fourth one. What does EDI stand for in a claim submission? Okay, so do you guys know what is EDI? Okay, so the option is going to be electronic data interchange, electronic denial information, efficient data input. The D option is going to be electronic document input. Okay, so you guys know that we are submitting the claims or we are submitting the information from one entity to another entity, like from provider to an insurance company, and we are dealing with this kind of a stuff in a electronic way. Okay, so we are just going to shift that kind of a things from one person or one entity to another entity electronically. So the option A is going to be the correct one, that is electronic data interchange. Okay, so in claim submissions, normally all the providers are going to submit their claims electronically. Okay, so the option A is the correct one. The question number 5 is going to be, what is the role of our clearinghouse in claim submission process? Okay, do you guys know what is a clearinghouse? And you guys know that basically the clearinghouse is going to act as a bridge between the provider and the insurance company. Let's see the options first. Okay, so option A is going to be to diagnose patient conditions, to process payments directly. Option C is to verify claims and forward them to payers. To deny claims, yes, the option C is going to be the correct one, to verify claims and forward them to payers. So clearinghouse are acting as a bridge between the provider and the insurance company. They are going to rectify, or they are going to find out if there is any kind of a discrepancy, if there is any kind of a error, and they are going to uh, return back that claim to the provider. Hey, this claim is having this kind of a issue, so you guys need to fix this one before submitting to an insurance company. So once the error is removed, then the clearinghouse is going to forward that kind of a claim to an insurance company. So in this way, clearinghouse is going to work. Okay, so let's see what is the next question. Next question is going to be, what is a payer ID in claim submission? Okay, so payer ID, as the name reveals. So first of all, let's see the questions and the options of this question. Option A is going to be the identification code for the patient. Option B is the identification number of the healthcare provider. Option C is the unique identifier for the insurance company. Option D is the ID for the coding system. So what should be the answer of this sixth question? That is going to be the option C, the unique identifier for the insurance company. So the payer ID, okay, this is a specific ID. Okay, so that could be like you can say that account number where we are going to submit the claims. Okay, so this account number contains different kind of like electronic addresses. Okay, so in this way, if a provider has an electronic ID of a payer, then we can just submit the claim electronically to that kind of a payer using their electronic payer ID. Okay, so this is the basically purpose of sending the claims electronically from one entity to another entity, means from provider to an insurance company. Okay, next is question number 7. What is a rejected claim? What should be the options? Okay, so option A is going to be a claim that is fully paid. Option B is a claim with coding error. Option C is a claim denied due to fraud, or a claim returned due to errors before processing. Okay, so what should be the answer of this one? You guys need to think about this one. Okay, before I tell you the answer of this question, you guys need to think, and you guys need to focus on these questions and think what should be the rejected claim. Okay, what should be the, I have a question about to you guys, like what is the difference between a rejected claim and a denied claim? You guys can just comment on this video. Okay, so let me tell you about this one. Answer D is the correct one. A claim returned due to error before processing. So once you are going to submit a claim, and insurance is not going to process that claim, not going to provide you any kind of a ERA or EOB, and they are clearly rejecting that claim. So that is the main reason that claim can be called as rejected claim. Means insurance found any kind of error, and they have not uh, you guys can say that entered that claim into a adjudication cycle. Okay, and they have rejected that claim, they have not denied that one, because that, I am not going to tell you the denied one, because I have already asked you guys what is the basic difference between the rejected claim and the denied claim. Okay, so rejected claim could be that is not completely processed, and insurance has returned back the claim to an insurance company. Okay, so now we will be seeing the question number 8. What is the allowed time frame for submitting a claim to an insurance company? Okay, normally there are different kind of time frames for insurance companies. Okay, so let's see the options first. So option A is going to be the 60 days. Option B is going to be the 90 days. Option C is going to be the varies by insurance company. Or option D is there is no deadline. So what should be the answer of this one? The answer of this one is going to be the question number C. Like it varies basically by the insurance company, because there are some insurance companies who are accepting the claims like within the 30 days after the date of service, and there are some insurance who are accepting the claims like within the 3 months, 6 months, or within a year as well. Okay, so after there is a date of service, like when the services were rendered to a patient, so a provider can submit a claim within that kind of a time frame. So basically it does means about this kind of thing. So it depends on the different insurance companies. Okay, so let's see what about the question number 9. Which document shows the details of payments, denials, and adjustments for a claim? Okay, so what should be the answer of this one? We have an option number A, CMS 1500. Option number B is explanation of benefits. Option number C is going to be UB04 form. Option D is going to be prior authorization form. Okay, so what should be the answer of this one? We are going to have that one is going to be the explanation of benefits, option B. Okay, so you guys know that when a claim is adjudicated by an insurance company, they are going to process that claim and they are going to let you know, guys, let the provider know that we have processed that claim in this kind of a thing. Like there would be allowed amount, total billed amount, how much there is a patient responsibility and how much they have paid, if there is a co-insurance of that kind of provider as well, okay, for that kind of a patient basically. Okay, so all that kind of a stuff can be explained in a paper form that is called the explanation of benefits. Okay, so the explanation of benefits is going to be sent to the provider, okay, and to the patient as well. Okay, so I have a question over here. So an ERA, like that is going to be quite similar with the EOB. So ERA is going to be sent to the provider and to patient as well, or if only to the provider or if only to the patient. So you guys can comment on this video. But I want to let you know, guys, that EOB is sent to both of them, to the provider and to the patient, to the both. Okay. So the 10th question is going to be, what is prior authorization? Okay, so option A is going to be patient consent for treatment. Option B is going to be a requirement by an insurance company before services are provided. Option C is going to be verification of patient demographic data. Option D is going to be submission of claims for payment. So what should be the answer of this question? Is going to be the option number B, that is a requirement by the insurance company before services are provided. Okay, so let me tell you about explain this answer, so you guys know that there are few services which needs to be authorized. Okay, so in the benefits of that kind of a patient, there are some services which can be rendered if an insurance company is going to authorize those kind of a services. So a provider needs to get the authorization before providing any kind of a services to that kind of a patient. Okay, so in that sense, a provider needs prior authorization. Okay, so what is the retro authorization? So you guys can comment and you guys can let me know what is the retro authorization. Okay, so which a provider required. Okay, so you guys can comment on this video. Okay, so let's see what is the question number 11. So that is going to what is the purpose of claim scrubber? What is a claim scrubber? Option A is going to be to clean data in medical records. Option B, to identify and correct claim errors before submission. Option D, Option C basically is going to be to process payments from insurance companies. Option D is to approve claim for payments. So what should be the answer of this question? Okay, so as the names depicts, that claim scrubber, scrubbing any kind of a thing, like the options B is going to be the correct one, to identify and correct claims error before submission. Okay, so a claim scrubber basically clarifies or basically removes any kind of errors which are found in a claim, like if there is a name issue, if there is a date of birth issue, if there is a member's ID issue. So any kind of like claims errors can be removed by claim scrubber. So scrubber is going to scrub all that kind of errors before submitting that claim to an insurance company. Okay, so our question number 12 is going to be, what is the purpose of the UB04 form? Okay, so we have already seen that CMS 1500 form was sent to an insurance for the outpatient services. Now, what is the purpose of UB04 form? To bill for inpatient and hospital services. Option B, to verify patient eligibility. Option C, to report outpatient services. Option D, to file appeals for denied claims. So what should be the answer of this 12th question? That is going to be the answer A, option A, to bill for inpatient and hospital services. Okay, so if there is an inpatient services where a patient is admitted to a hospital, okay, so if inpatient services are provided, then a claim can be sent on UB04 form. Question number 13, which code is used to identify supplies, medications, and services not covered by CPT codes? So what kind of a services that are not covered by CPT codes, current procedural terminology, then what should be considered and what should be the correct kind of a answer of this question? Option A is going to be ICD 10CM. Option B, NPI, National Provider Identifier. Option C is HCPCS, Healthcare Common Procedure Coding System. Option D is the CPT same, current procedural terminology. So the option C is going to be the correct one, that is healthcare common procedure coding system. So anything which is not included in the CPT, that is going to be counted in as HCPCS, like durable medical equipments, some drugs, okay, medications, crutches, and you guys can say that the beds where the patient is going to use those, okay, oxygen cylinders. So all that kind of a services, ambulatory services, so all that kind of a stuff can be included or counted or billed under HCPCS. Okay, so the question number 14 is going to be, what does the term capitation means in healthcare payment system? Okay, so that is a good question. Okay, our interview person can ask this question. So the answers, possible answers are, question option A is fee for service model, a fixed payment per patient to a provider, payment based on service rendered, retrospective payment model. So what should be the answer of this one? That is going to be the option B, a fixed payment per patient to a provider. Okay, a patient is going to provide or going to pay any kind of a fixed payment, that is called the capitation fee. Okay, so what is the 15th question? That is going to be the, what is coordination of benefits? Okay, so option A is going to be ensuring all patients are insured, coordinating payment between multiple insurance companies, managing denials and appeals, referring patients to specialists. So what should be the answer of this one? That is going to be the option number B, that is coordinating payment between multiple insurance companies. Okay, so if a patient has multiple insurance companies like primary insurance and secondary insurance, the primary insurance has the information that this member is going to have a secondary insurance, and the secondary insurance also has the information that this member has primary insurance. Okay, so once the claim is submitted to a primary insurance, the primary insurance pay their part, and the rest of the money is going to be transferred or forwarded to, or it is automatically crossover to a secondary insurance. Okay, and after the processing of secondary insurance, the rest of the amount will be the patient responsibility, that will be made by the secondary insurance. Okay, so in this way, if a member or if a patient has multiple insurance companies, then that could be called as coordination of benefits. Okay, so that was the 15th question. Okay, so thank you so much for watching me again, and these are the beautiful and the top kind of questions that can be asked for your interview about claims submission. Okay, so next lecture will be on the payment posting. So we will see that what kind of a possible questions can be asked about payment posting. Okay, so if you guys have any kind of a questions or queries regarding medical billing or any kind of a thing, then you guys can let me know. We have already completed our medical billing course. Okay, so that is already uploaded in a series where you guys can just learn that one from my YouTube channel. And if you have any kind of a questions regarding medical billing or medical coding, we have already initiated the medical coding course as well. Okay, so inshallah we'll meet in the next lecture with different kind of a stuff in medical billing and coding. Till then, take care of yourself and of your family, and do remember me in your kind prayers. Take care. Allah Hafiz. Goodbye.